Let's understand alien hand syndrome, also known as Dr. Strangelove syndrome. This is a rare neurological disorder. It is characterized by the perception that one hand is acting independently on the will of its own. This condition challenges our understanding of consciousness, free will, and the complex working of the human brain. So let's deep dive into the history, causes, symptom, and treatment option for these rare neurological disorder, real life cases that bring the syndrome to the life. The first documented case of alien hand syndrome dates back to the early 20th century. In 1908, the German neurologist Kurt Goldstein and Hans Gelb describe a patient who experienced involuntary movement of her left hand following a stroke. The patient reported that her hand seems to have a will of its own, often interfering with her intended actions. However, it wasn't until 1972 that the term alien hand syndrome was officially coined by neurologists Joseph Bogen and D. Frank Bosen. They used this term to describe the behavior of patients who had undergone corpus callosectomy. This is a surgical procedure that involved severing the corpus callosum, which is the brain part, to treat severe epilepsy. To understand alien hand syndrome, we need to understand the complex working of human brain. The condition typically arises from the damage to a specific area of brain responsible for movement control and interhemispheric communications. The corpus callosum, or the bundle of nerve fibers, connects the left and right hemisphere of the brain, allowing them to communicate and coordinate action. The frontal lobes are crucial for executive function, including planning, decision making, and voluntary movement control. The parietal lobes are involved in the sensory integration and spatial awareness. The supplementary motor area that play a vital role in the planning and initiating voluntary movement. When these areas are damaged or disconnected, it can lead to the bizarre symptom associated with alien hand syndrome. Scientists have identified several variants of alien hand syndrome, each associated with damage to different brain regions. The frontal variant is associated with damage to the medial frontal cortex and anterior corpus callosum. It typically affects the dominant hand, usually the right hand in the right-handed individuals, and it is characterized by the groping, grasping, and utilizing the object within reach. The callosal variant happens when the corpus callosum is damaged, causing the two hands to work against each other. The posterior variant involves damage to the parietal lobe and the back part of corpus callosum, which lead to less coordinate movements and the feeling that the affected limb is not really part of the body. Alien hand syndrome can arise from various neurological conditions and events, including neurosurgery, particularly procedure involving the corpus callosum, such as corpus callosectomy for severe epilepsy. Next, a stroke affecting the corpus callosum or frontal lobes, brain tumor in the frontal or parietal lobes, and neurodegenerative diseases like Alzheimer's disease and traumatic brain injury from severe head trauma. So alien hand syndrome can cause many different symptoms, but the most common one is when the affected hand moves by itself. This means that the hand might grasp things or do more complicated action without the person wanting it to. Sometimes the hand might even try to hurt the person, like trying to choke their own throat. Individuals with the alien hand syndrome may not be initially realize that their hand is doing until it catches with their attention or someone point it out. In some cases, the affected hand may act directly opposite to the unaffected hand, leading to intramanual conflict. Some individuals describe their affected hand as having its own personality or will, often referring to its the third person. Other symptoms can be include sensory deficit, apraxia, which is the difficulty performing skill or learned movement with the affected hand. And sometimes when they move one hand, the other hand might copy the movement without them wanting it to. To truly understand the impact of alien hand syndrome, let's look at some real life cases. So there is a person named Karen, a 58-year-old right-handed woman, experienced a stroke affecting her corpus callosum. In the weeks following her stroke, she began to notice her left hand behaving strangely. It would reach out and grab objects without her intention, sometimes even throwing them across the room. Karen described feeling as if her hand had a mind of its own. Karen's case is typical of colossal variant of alien hand syndrome, where damage to the corpus callosum lead to a disconnected between the brain hemispheres that resulting in uncoordinated and conflicting hand movements. So next case example is Sarah, a 65-year-old retired teacher began experiencing symptoms of alien hand syndrome as part of progression of corticobasal degeneration, a rare neurodegeneration disorder. Her right hand started to show involuntary movement, often reaching out to touch or grasp nearby objects. Sarah explained that it felt as if her hand had developed a curiosity of its own, reaching out to touch people's face or grasp onto doorknobs as she walked past. Sarah's experience highlights how alien hand syndrome can manifest as part of broader neurodegenerative process, adding an additional layer of complexity to an already challenging condition. Let's try to understand the diagnosis of the alien hand syndrome. So diagnosing alien hand syndrome involves a thorough checkup by a neurologist. The doctor watches the patient's movement to see if they are doing anything involuntary. They will also ask about the patient's medical history to learn when and how the symptom started. Neurologists will test how well the patient can move, feel, and coordinate their action to see how the nervous system is affected. So brain scans like MRI or CT scan are important to find any brain damage or abnormalities causing the symptom. So next is cognitive test. So cognitive tests help rule out the other condition with the similar symptom. Sometimes an EMG test is done to measure the electrical activity in the muscles of affected limb. While there is currently no cure for the alien hand syndrome, various treatment approaches can help to manage the symptom and improve the quality of life for those got affected. So occupational therapy play a crucial role in the helping individuals with the alien hand syndrome adapt to their conditions and maintain independence in the daily activities. Therapists help patients by teaching them to use special tools to make tasks easier, learn ways to manage and change unwanted movement, and find the new way to do everyday activities. So physical therapy aims to improve control of the affected limb and overall coordination through exercise that build strength, improve balance, and increase awareness of limb position. So there are several other ways to help manage symptoms of alien hand syndrome. One way is to keep the affected hand busy with the object, which can help reduce involuntary movements. Using visual cues can help you stay aware of the affected hand, and some people find that giving verbal commands to hand can temporarily stop unwanted movements. While there is no specific medication for alien hand syndrome, doctor might prescribe drug to treat underlying condition or specific symptoms. So medication that reduce muscles activity, botulinums, the toxin injection to temporarily paralyze overreactive muscles, and drug for conditions like Parkinson's disease or epilepsy might be useful. Another is cognitive behavioral therapy that can help people with the alien hand syndrome deal with the anxiety and depression. It teaches coping strategy for frustrating situations and improve the emotional well-being. Assistive device like weight gloves or bracelets can reduce involuntary movements. A specialized utensil and the tools for one-hand use along with safety equipment can help maintain independence and prevent injury during the sleep or daily activities. So living with alien hand syndrome presents unique challenges that extend beyond the physical symptom. Individuals with this condition often face emotional distress, including feeling of frustration, anxiety, and even depression. The unpredictable nature of alien hand syndrome can lead to embarrassing situations in public, potentially cause the social withdrawal. Involuntary movements can pose a safety risk, particularly when the handling potential dangerous object or during activities like cooking or even driving. The experience of the having a part of one body act autonomously can profoundly impact an individual's sense of self and the bodily integrity. Coping strategy that individuals with alien hand syndrome and their caregiver have found helpful include education about the condition, support group to connect with others who have alien hand syndrome, adaptation to home and work environment, mindfulness and relaxation technique, and open communication with the family, friend, and colleagues about the condition to foster understanding and the support. So alien hand syndrome remains one of the most fascinating and the alien hand syndrome remains one of the most perplexing condition in the field of neurology. It challenges our understanding of consciousness, volition, and the intricate working. So thank you for watching and see you in the next video.